So we think now that maybe, or I think that inflammation might be kind of an outdated term, and all the itis words that are in all of the Medicare guidelines and coding systems, not really accurate to today's science, but it's what we're stuck with. However, because of the wellness industry, because people are more interested in their health, and because we realize that despite the massive amounts of money, and think about how much you spend on your health insurance, despite all of that, nobody's getting better. Everybody's feeling bad. The disability rolls are still high. The number of total knee replacements are going up. Hospital inpatient stays are going up, et cetera, et cetera, et cetera. And you would have to ask yourself, why? So a lot of people are starting to learn how to take care of themselves. Because of this big push, kind of like a groundswell, we're starting to learn about chronic inflammation, non-communicable diseases, circadian medicine, things like that. So Ledbetter described the classic inflammatory response. You activate the platelets, that activates the endothelium, which is a lining of the blood vessels. You recruit in and call in more leukocytes, which are white blood cells. And then there's repair and proliferation after the pathogen or the injury is killed and cleaned up. So that has to happen first, then you can repair and remodel. So acute inflammation, we already talked about that. This is the innate system. This is when you recognize non-self. This is vital for survival. We want some inflammation. We want the ability to have inflammation. You want an immune system, obviously. Think about HIV, AIDS before it was treatable, that it destroyed the immune system. Think about diabetes. It destroys the immune system. Think about being on anti-rejection drugs if you have received an organ transplant, destroys your immune system. You want an immune system. So it's vital for survival. So if I got a bacterial infection, it would fight that off. If I got a cut, my immune system would clean that up, remodel it, and you would not even know I ever had a cut. So we want that, right? We just don't want it to be hijacked. We don't want it to convert to a chronic situation. So look at these two pictures. This is normal skin, and then it's skin next to an incisional wound. So it's not even at the wound, it's next to it. Look how much thicker. Look at all those white blood cells that have filled the areas. So this is response to injury, right? You want this initially. You've got to promote angiogenesis. You need to get new capillaries to come in. You need to stimulate the cells to produce more skin. You want to have fiber or collagen under that. And this is how things like microneedling work for facial reconstruction or rejuvenation. You want to stimulate through injury the immune system to build up more collagen. And then what happens is more genes that promote healing and remodeling are turned on if it's done correctly.